I'm Craig Campbell. I'm Director of Continuing Professional Development at the Royal College of Physicians and Surgeons of Canada, and I've been honored to serve as the moderator for this first session. For those of you who would like to use Twitter to share your thoughts about what you're hearing with others, just a reminder that the Twitter hashtag for this is IMS Sydney, and there will be a sort of a rolling sort of Twitter board outside the room if you want to see how that is going. There may be, if there is, in the unlikely event that there might be some fire bell alarms, the staff here will help us to exit the building. And if you have any issues or concerns, please let our event staff know. We'll be happy to help you. I was asked to try, as we thought about this new era of the future and the challenges of the medical profession, to maybe take a look back at what we discussed in 2015 as a preliminary sort of foundation for our conversation today. How many of you were here in Melbourne in 2015? Okay. So about 2/3, but not necessarily everyone. So we've, as you could probably see if you're looking and paying attention, we've actually changed the order of this already, so it's a very fluid idea. But I'm going to try and just give a few ideas of some of the themes we talked about, because they'll come back, I think, again and again, and we wanted to have a little bit of a look back of what did we talk about in 2015, how are we doing a year later, and that as a foundation for moving forward into the other elements of our conversation throughout this day. So this is my conflict of interest declaration. So 2015 was about the future of the medical profession. We had 17 speakers from 5 countries where the focus, as you can see on the screen, was to look at the issues, the challenges, the influences that were affecting the future, not just of the practice of medicine, but of the medical education system that is preparing our residents as they graduate to practice within various contexts. The dominant theme for throughout that symposium was about change, and I just picked 3 areas of change that we centered on significantly. The shift to a more patient-centered collaborative practice, the need for greater transparency within the health system around quality and safety of care. One of the speakers said that she had more information about the quality of the food in the cafeteria than the very quality of the care that she was going to be receiving. And the need for greater flexibility within our medical education system. The idea of embracing patient-centered care was about addressing some of the concerns that our panelists and speakers noted around the drift they described towards increasingly subspecialized silos. And the patients advocates that were speaking last year talked a lot about their difficulty in moving from silo to silo, the lack of coordination and communication and fragmentation of the care that they were receiving, that they had difficulty knowing how to gravitate towards that. And there was an appeal for a new vision that patients are not only important in terms of decision-making with their physicians, but should be actually central and members of the healthcare team that's delivering care and services to them. And that rather than the patients coming to the medical profession, that we should be delivering care closer to where the patients are in the very communities in which they are living. And Carol Eschenbrenner coined a lovely phrase: instead of the doctor will see you now, the patient will see you now. Embracing transparency was around the need that we need to transition towards patients having the ability to access institutional measures of quality and safety, how we are performing, as individual physicians or our health teams, how they're doing, and access to the very test results so that they have easy access to know exactly what the results were when they had a test ordered. And we had a panel of 4 really excellent medical students or residents who were talking about how adequately they felt they were prepared to practice in their field. And most of them said they felt very reasonably comfortable with practicing within their medical expertise. But in areas such as self-care, communication skills, the complexity of professional behaviors and how to deal with the ethical issues and dilemmas within the workplace, they didn't feel as well prepared. And they called on us as colleges to think about how we could adapt their medical education training so that they had more opportunities to pursue their own personal goals. And the last theme I'll just highlight is around the need for an empathetic, compassionate workforce. Around patient care, this was not just about how well we communicate and relay medical information to patients, but the way in which we listen to them. That we are not just there for disease management, but to think about health and well-being in a more holistic way, and our ability to relate to them on a more human level. And for ourselves as physicians, at least those who were there, the need for a workplace that is both safe and healthy. A focus on the fact that we need to be healthy if we're going to care for patients in an effective way. And we need to, and there was a great interest in trying to realign work-life balance, because many felt that their work-life balance was certainly more tilted towards the work side. And that the way in which we treat each other in the workplace needed to significantly change and enhance the ability for us to care for each other within a healthy environment.